It is 12:02. We are back. Your phone calls 416-870-6400. You have issues, pain issues, problems. Bring on the phone calls. Dr. Lou is here to answer all of your problems today, right up until till 1 o'clock. 416-870-6400, star 640 on cell. Outside of show hours, of course, go to info@paincarecanada.com and your number 1-855-55 Lou, DRLOU. So what's going on today, pal?
Not too much. Actually, a lot of people have been getting confused with the number. They're not sure how Lou is spelled. It's LOU. So for all, yeah, I know.
Not like Lou time.
It's, I didn't think it was that difficult, but I guess it's LOU. Yeah. No. How are things with you, John?
Good, man. Good. Back at the gym, so I'm in pain every day, but that's the nature of the beast.
Well, hurt versus harm, right? So it's right. It's hurt, but it's not necessarily harmful to be in the gym, and you got to go through that process. So that's good. Active living is very important. So for this week, one of the interesting cases that I saw that I really wanted to share with people, and you'll laugh at this, John. So I had a gentleman come in. He was, I guess, listening to the show last week, I believe he said, and he just caught kind of the tail end of it.
Right.
And we were talking about back issues, and he was sitting there, and he had suffered. He was going to use the washroom, and all of a sudden he had this excruciating pain in his low back that literally took him down.
Yeah.
He had to get a couple of his workers to actually help him up and get him home to just take a bunch of meds and stuff.
Brutal.
He was sent to the emergency room. When he was at the emergency room, he was given a referral to a neurologist.
Okay.
The appointment was in August, and
of 2017.
Of 2017.
Nice.
So in August, and it just highlighted to me. Actually, what happened was when he actually got into my office, which was about a week later, he walked in totally fine. He was out of pain. He was totally fine. Natural history took its course, and he was better. But he still wanted to come in, get a second opinion.
Try to see why.
Get an understanding of, hey, what's going on here? So I did what I always do. I went through my full history physical exam with him, was able to determine that likely what he did was injure the disc, and that this wasn't necessarily that's happened that day, because he did have a history of low back issues, and it was kind of the straw that broke the camel's back. And finally, he ended up aggravating the disc so much that it caused probably a disc bulge or a disc herniation. And, because it's the first time that happened, it just kind of reabsorbed on its own after a few weeks. But I explained to him that, this is not something that's ever going to go away. He now has to be careful. A lot of the times with these things, when they go away, people think that they're totally fine, and that's not the case. You do have to do things to take care of that. And so I basically educated him on exactly what happens with disc issues, the things to avoid, the things to do to help prevent it from coming back. And so then as I was talking to him, I just wanted, and I thought this was so important to highlight to our listeners and the advantage of what I'm offering. This person was going to have to wait until August to go see a neurologist, which he didn't have to see a neurologist because he had nothing wrong neurologically, because I do that in my office too. I do a full neurological exam on every single patient that walks in my door, and there was nothing wrong with him. So he would have gone there, would have been a useless appointment. He would have gotten nothing out of it. It would have cost the taxpayers money, and it would have just been a big waste of time. Instead, he was able to come see me within a week of his issue, and that's one thing that I want my listeners to know, and our listeners here on the show. You can call the 1-855 number, and there's option 2. If you click option 2, it's an actual voicemail that's left for me. And I listen to every single voicemail, and I do my very best to return the call within 48 hours. And I think I'm pretty good at it. And then I'll spend some time talking with people. And if I think that it's something that I can take a look at and help them with more, I'll get them in the office. And we're able to get people in the office within a week of that call. And so the turnaround time is incredible for healthcare, I think.
And you probably set him up with exercises and things he has to do to keep it in check.
And so he's an example where I basically told him, listen, if you're fine, that's great. And again, I educated him on what likely caused the issue, what other things in the future that if he does can aggravate it, and some simple things that he could do to help prevent it. And that was it. And I basically said, if it happens again, come to us sooner. And that's basically it. He was extremely happy, ecstatic. He couldn't believe that, that he was mismanaged, quote unquote, the other way, and just being told go see this neurologist, having to wait till August. Crazy. And this stuff happens all the time, and we're available for these second opinions for people in a timely manner and an efficient manner that will actually get people the answers they need. And don't get me wrong, if this person had come to me, I saw similar cases where people were referred to a neurologist, but there was a long wait period, or a neurosurgeon. And after I review their full history, I review their medical documents, I basically say, you have to go see this neurosurgeon. And then I'll try to actually expedite things for people.
416-870-6400 *640 on cell. Elaine, good afternoon. Opening call. How are you?
Hi there. I'm okay.
Good. What's your concern?
Well, I get a headache. I can tell you, like clockwork, on Saturday night, I will be so, I'll have like a pressure headache, sinus headache, I don't know what you want to call it, in my forehead, to the point where I'll actually throw up. Okay. I think I know what's causing it, but I don't know why, because it only happens after I've been to my karate class in the morning. I go to karate class 3 times a week, like twice in the evenings after work, and then once on Saturday morning. I don't get the headaches after, like, in the evenings when I go, but on Saturdays when I go, I always get a headache. If I happen to miss a karate class, I don't get the headache. It's a pretty strenuous workout. I don't know whether it's because I'm eating or not eating, or, the amount of time I'm awake before I go work out. I don't know what would cause it, but I just know that if I go to class, I get a headache. If I don't go, I won't get it.
So when you go those 2 times in the evening, you're fine. There's no issue.
I'm fine.
Versus if you go the Saturday morning, then by Saturday evening, you'll tend to get a headache.
I've got like a migraine where I'm throwing up.
Okay. Yeah. So a couple things there. There's probably a couple things that could be the cause of this. You mentioned one thing, which was rest. Probably on the evenings during the week when you're going there, you're doing your workout, then you're probably not going to sleep within the next 2 to 3 hours or 4 hours even. And so you're allowing your body time to rest. And that's very important after any type of strenuous activity versus on the Saturday, you're going in the morning and now all of a sudden you've got, another 12, 13, 14 hours before you get to bed to rest. And so that may affect it as well. Are there any other activities that you tend to do on Saturdays that don't happen during the week?
Not really. Nothing like that. I mean, you do errands, watch TV, whatever. I don't do anything else that's I'm pretty sure it's related to the exercise in the morning.
Right.
Because if I don't go, no matter what else is happening, I won't get the headache.
Do you eat before you go on Saturday mornings?
I'm not much of a breakfast person, but I try to get something like a cup of coffee and, and I don't know, some granola bars.
So, and that may be the difference there too, right? When you're going during the evenings, you've already had a day of meals. And so, you have the right nutrients to support the activity that you're going to be doing versus when you're going on Saturday morning, you don't really have many nutrients except for whatever's from the day before, which likely has already been processed. And so you're kind of going there and relying on your body to use its stored energy in the terms of whether it's carbohydrates stored within the cells, or break down a fat or break down a protein.
Glycogen or whatever. All that stuff,
exactly. So a lot of the times what could happen is the body prefers, and especially the brain, prefers to use sugar as its source of energy. In fact, the brain will do whatever it needs to get energy as sugar. So even if that means breaking down fat into sugar or muscle into sugar, it will do that. And so it's often a good idea if you are going to be doing activities that you try to have some type of
trying to get a meal into you.
Yeah, a good meal and a good carbohydrate, something that is again is glucose. And the thing is understanding also the type of glucose. So, for example, if you had say something like a fruit, which is more of a simple sugar, a simple carbohydrate, it's going to go through your system much quicker. Versus if you had something like whole grain bread, because it's more complex, it takes a little bit longer for it to go through the system. The other thing you can do with the simple sugar, so let's say you're more of a fruit person and you'd prefer to have fruit in the mornings, you can also add a little bit of fat and protein to that in order to delay the gastric emptying of the simple sugar. So, maybe having avocado. It with eggs or avocado, exactly, those types of things. But I would definitely try. Again, a lot of these things, when you have headaches, one of the big components that we advise our patients to do is called a headache diary, where you start to look at the common features that happen around your headache so that you can, experiment yourself on what you can do to eliminate it. So I would say, try having breakfast before you go, and see if that helps on the Saturdays. And if it does, then likely you may have you may have figured out what the problem is. And in the absence of that working, give us a call, and we'll try to figure out what else it could be.
Appreciate the call, Elaine. 416-870-6400 star 640 on cell. More of your phone calls coming right up. The lines are open. Want to drop a call in? Dr. Lou ready to talk to you here on the Dr. Payne Show. Talk Radio, AM 640. It is 12:15, 416-870-6400, star 640 on cell. Make sure you go to info at Pain Care Canada. You want to email Dr. Lou or 1-855-55-Dr. Lou, DRLOU. It's a simple Lou. That's it. No special Lou right there. Tat, how are you?
I'm not bad. How are you doing?
Good. What's going on with you?
Well, I've had a problem with my back for a while. I go to an osteopath on a regular basis. I used to go to a chiropractor. Then I switched to the osteopath. He seems to help me when I get out of his office. He's okay, but then it's always coming back.
Mm-hmm.
And he's explained that maybe it's my coccyx bone or coccyx, however you pronounce that.
Yeah.
Coccyx. And he says it's kind of, I guess, rotated to the right, if that's possible. And that's what ends up happening is I cannot cough without dropping to the floor. I can't sneeze without dropping to the floor. If I'm sitting down and I try to get up, sometimes it'll just pull me right back down again, and it is very, very painful.
And so it's pain that low in the buttock, like right at the coccyx, or the pain is higher?
It's a little bit higher.
Yeah.
It's almost at the center, the top center,
Right.
in that area.
Like lumbar area?
Yeah, so those types of symptoms like coughing, sneezing, bearing down, that's mimics what we call in the healthcare profession a Valsalva maneuver. A Valsalva maneuver is essentially like a cough, a sneeze, where intra-abdominal pressure increases, and so things like disc herniations tend to get aggravated during those periods of time. So, again, it's very hard for me to say with certainty, but in hearing that type of a symptom, again, I would start to go down the path of probably something like a disc issue. And then, the next thing becomes, what are the interventions being done by the healthcare professionals? Are they tailored towards actually correcting the problem of the disc herniation? One of the things with osteopathy, I guess, is a lot of the times they tend to look at, this is shifted this way and that's shifted that way, et cetera, et cetera. Yep. And they only tend to focus on that. And I'm not trying to say that it's wrong to focus on that. But see, here's the problem that I have with healthcare in general and with not most practitioners, but a lot of practitioners, is that, when you have a hammer, everything's a nail. So if you're an osteopath and that's your way of thinking, that's the way you look at it. If you're a chiropractor, that's your way of thinking, that's the way you look at it. If you're a physio, if you're a surgeon, et cetera, the list goes on. Mm-hmm. This is where getting that kind of second opinion. What I really try to do, and what I've prided myself on, is trying to look at everything from every possible angle and understanding what it is that you have done, that you haven't done, and making supplementations in that way to see if we can help it in that regard. The other thing that happens with consistent treatment, and I hear it very often, where people will say, yeah, I'll go see X professional, 2 times a week, and when I leave, I feel great, and then slowly it starts to come back. Right. That's very simple in healthcare. That's called dose response. The one thing that we tend to do wrong with physical medicine and also with medication in general is we forget that we should be weaning people onto a therapy and then weaning them off a therapy in order to have their bodies not adapt to anything. Because we've talked about this, John. Yep. If you run 30 minutes every day, you're going to lose weight up until a point where your body is now used to you running 30 minutes a day. And so it's the same thing. You take a Tylenol. We were just talking about alcoholics off the air, right? Yeah. Where we were talking about once you get used to a certain amount of alcohol, your body adapts to it. You no longer feel the effects. It's the same thing with therapy, and it's done wrong all the time, just because of the very fact that, unfortunately, there's also a secondary gain benefit, which is money to the practitioner. They don't necessarily always want to wean people off of therapy because that means that person may not necessarily be coming back. But, you're a good example of someone that I think if I could assess, I could really get to try to figure out the root cause of what's going on and make the right recommendations based on that.
Tat, the number 1-855-55 Dr. Lou. We'll get Angela in here before we break. Good afternoon, Angela. How are you?
I'm good. How are you?
Okay. What's going on with you?
Okay, so I've the last year or so have developed bursitis in my right hip. It's a particular type. It starts with a T. I just can't remember it. Something T.
Trochanteric bursitis.
Yeah, that sounds right. I have not had an injury. It just sort of started developing. I've been doing chiro. Had an X-ray. It's all normal. Mm-hmm. I'm doing the icing. I'm doing the stretching. I'm doing the chiro, and it's the same. It really doesn't get any better. So I'm really not sure if it should be looked at in a different medical way, sure, or I'm not sure.
Yeah, so let's start with one thing there. And people often say, I'm doing physio, I'm doing chiro, I'm doing this. Those are names of professions. What is the chiropractor doing with you? What types of interventions?
Okay, so he'll do some stretches with me. So he'll in a way that it actually feels like it's getting some relief.
Yep.
Momentarily.
Yep.
He's also working on my lower back, which was something, not an injury, but he said my pelvic is a little crooked. Mm-hmm. So my X-ray shows it, and that may be contributing to it. So he's treating both.
Right.
Hoping that, if I sort of straighten out the lower back, it may take off pressure on how I'm walking on my leg.
Okay.
Affecting the hip.
Yep.
But it's just nothing's really changing. So
right.
I'm not really sure if this is something I'll just have to deal with forever, or what?
Not necessarily. So let's start with let's make a few assumptions, assuming it is for sure a bursitis. Because it may not be a bursitis. Oftentimes with trochanteric bursitis, what it actually happens with is with something called greater trochanteric pain syndrome. And what that is you kind of have to look at everything, and it sounds like your chiropractor is doing that, everything in relation to that hip, the low back, the knee, the muscles surrounding the bursa, and try to treat it that way. What happens with a bursitis, that bursa is laying between a piece of bone and muscle just so that those two things don't touch and don't eventually snap. And so sometimes with a true bursitis, what happens is that bursa actually inflames. So what you have to do first before anything is control the inflammation. And once you've been able to control the inflammation and make sure that it's not inflamed anymore, then you can start working on the other things that may have caused the bursitis in the first place. So sometimes throwing the whole kitchen sink at it is not necessarily the best idea, and grading the therapy is often a better idea. And so what I like to do usually when I look at a patient is say, okay, first and foremost, pain management. How do we get that pain under control, that inflammation under control? Good, that's under control. Now we move on to the manual medicine, the things that, the tight muscles that maybe we can release, the joints that we can release so that we can help that problem. And then the rehabilitation aspect, which is the active component of what the individual does, which is what do you do during your life, the exercises you have to do in order to prevent this from coming back.
Mm-hmm.
So
all right.
give us a call. We can definitely take a look at that, Angela.
Angela, 1-855-55 Dr. Lou, DRLOU. We'll take a short break about your phone calls here in the Dr. Payne Show, Talk Radio, AM 640. 1226, we continue here. Be patient. We will get to each and every one of you as we roll on here. Nick, good afternoon. How are you?
Good afternoon. How you going, guys?
Good. What's going on with you?
Good. All right. So I was dealing with a really pesky cough for about 2 weeks. About a week ago, I woke up and felt some tightness in my left shoulder from my neck to my rotator cuff, and it just felt like a tug if I turned my head a certain way, but no. That's alleviated. It felt a little inflamed, but I feel my shoulder is still weak. Like if I elevate my arm, it just feels like it feels not as strong as it used to. So just wondering if it's dealing with a muscle strain or a pinched nerve.
Yeah, so it could, in all honesty, it could be either or. It could be just from the coughing. When you're coughing, obviously, you're working a lot on your chest expansion and all those muscles around the thorax attach in some way or another and help with chest expansion. So oftentimes during coughing, if someone's sick, they do tend to develop neck, upper back problems. But the other thing that it could be, based on you saying weakness, which, leads me down more to a neurological type of symptom, is, again, this is the way people sometimes hurt discs is through coughing, because I just mentioned that, a cough, a sneeze, those are mimic what's called a Valsalva maneuver, which increases the pressure within your body. And sometimes these weaknesses in the discs happen over your whole life, similar to the story that I was saying of the patient that I saw. That happens throughout your whole life. Then it just gets to a critical point where all of a sudden you do something to increase that pressure, and then boom, you get
quote unquote throw your back out.
Yeah, you throw your back out or you throw your neck out. And so it could be something like that. So, you're right. It could be either or. This is where obviously having it assessed properly is really going to, make me able to actually be confident one way or another. But yeah, it sounds like it could be either or of those things.
All right. And And so when it's a pinched nerve, what are some of the associated symptoms that you should be looking for other than the weakness? Is there does it have to have shooting pain? Because I don't feel the shooting
not
pain.
necessarily. It could have weakness. It could have things like numbness and tingling, pins and needle sensation, burning sensation. Sharp could be one of them. So there's all different types of things that could be related kind of to neurological type of pain.
Right.
Okay.
Oh, sorry. Sorry.
Oh, you cut him off.
Yeah,
John, come on.
So nasty. Call me back, Nick, if you need. I was going to say the number 1-855-55 Dr. Lou to follow up, Nick. If you want to make an appointment, feel free to do so. Mara, hello.
Hi,
How are you?
I'm okay. How are you?
Good. What's your concern?
Okay, it's regarding my son. He has acronoiditis. I don't know if you know what that is.
Yeah, I'm going to assume it's something related to the acronoids.
It's a nerve disease,
Okay.
and he is on all kinds of like Lyrica as a medication,
Okay.
and nothing is helping.
Okay.
And he's actually on disability because it affects his it affects him physically, obviously.
What are some of the symptoms that he gets with this? Because I'm not overly familiar with this, actually.
The symptoms:
Yep.
sharp shooting pain,
Like where in his whole body? Where's the shooting pain?
the feet, the hips, the back.
Okay.
Now it's starting to affect his neck and shoulders.
Okay, so it's kind of so neurological symptoms throughout the whole body. And so what have they told him would be some likely courses of treatment for that?
Nothing.
There's nothing that can be done.
He had a couple of back surgeries,
Yeah.
and they did also injections.
Okay.
That's what caused it.
I see, and so nothing has really helped it. Okay, well, again, I don't want to give wrong or misleading information, and I'm not, I want to know my limitations, and I'm not actually overly familiar with this. It sounds like something that's probably rare, but what I can do, you have our number. Give us a call. I can speak to the neurologist that I work with, and see what her recommendations would be towards something like this.
Okay.
Okay, so the number's 1-855-55 Dr. Lou.
1-855-55 Dr. Lou.
Yeah.
Okay.
DRLOU. Got to take a quick break, guys. Lots more coming up. Your phone calls 416-870-6400 star 640 on cell. The Dr. Payne Show rolls on Talk Radio, AM 640. 12:33 in the afternoon. Your phone calls, 416-870-6400 star 640 on cell. Ramana, how are you?
Yes, hi.
Hi.
I'm 68 years old, and I recently had a little accident at home. I accidentally bumped my head on the edge of the table, and that happened on Thursday. And right after, on Saturday night, I experienced a spinning, and I couldn't sleep. I was like dizzy. I couldn't walk. I was losing balance, and I couldn't roll over in bed. I felt like I'm going to be throwing up. So I started Googling my symptoms, and it brought me to vertigo.
Okay.
So it's been already over a week, and I'm getting a little bit better, but I still cannot sleep well at night, and I have to wait until I turn over.
Okay.
And I'm worried that what's going to happen with me, I cannot function. If it doesn't go away, I cannot function because I keep experiencing this dizziness.
Okay, so have you had this looked at professionally by anybody?
No, not yet.
Okay, so then that would be step one, is go get this looked at professionally, because banging your head, and especially when age is a factor, is always a serious thing. It could be a couple of different things, some ranging from not so bad to something very bad. So I would say that a professional, like a walk-in clinic, your family doctor, a chiropractor in the area, whomever, to assess especially cranial nerve function and neurological function overall, to see if anything's there, and then they'll be able, based on those tests, to determine, okay, is this something that needs to be referred to a hospital or even an emergency room if that's all you have in your area. But this is definitely something, if these symptoms have been going on and you've banged your head and you have not had it looked at professionally, you need to go get looked at immediately.
Okay, but
Okay.
do you think that this little bang of my head, a little bruise, would cause something serious?
It could.
Concussion.
It could be a concussion, right? So, and if it's a concussion, that's fine. But sometimes things that seem ominous and not so bad can actually be very dangerous if you hit the right spot, if there was a previous weakness there, if you have a family history of like strokes in the family, anything could set it off. It's not something, anytime you start getting any type of symptoms like you're describing after trauma, although the trauma may be minimal, I think it's important to get that looked at.
Okay.
Okay?
Okay, appreciate the call, Ramon. Again, any more information, rather, 1-855-55. Dr. Lou, Jamie, how are you?
Are you talking to Jeannie?
We're talking to Jamie. How are you?
This is Jeannie.
Oh, Jeannie. Okay, I got a different name written here. Jeannie, how are you, Jeannie?
Hi, how are you today?
Okay, what's your concern?
Okay. I don't know where to begin. I don't know where to end. Okay, about 2 years ago, I was rushed off to the hospital because I had a severe diarrhea and I lost all my electrolytes. So that's history. Then I had to go on medications through a nurse practitioner and a psychiatrist because I guess I was mentally declining. Well, what's going on in the last year, I'd say, is a very bad burning sensation in my rectum. Now, I've been seeing a naturopathic doctor, and he has me on HMF Neuro Powder. It's a probiotic formula. And basically, that's all he's got me on. And then on regular L-glutamine to try and heal up the lining.
Okay.
So I've put baking soda, a teaspoon of baking soda, and warm water in a sit bath. I put apple cider vinegar in the sit bath.
Okay, so let me stop you for a second.
Yep.
What have you been told is the issue? What has been the diagnosis?
I don't even really know. I've been to a Dr. Padeneau, which is a doctor for down there. I've been to the Rudd Clinic, and they see nothing really wrong.
Okay.
They see nothing really wrong, but I've got this bad burn as I speak that I want to go in a sit bath right now and sit in warm water and try and soothe it. So I've put hemorrhoidal cream, but they're not seeing hemorrhoids. There was, but it seems to have gone down.
Okay, so let me stop you there for a second. So what are you looking for from me?
What do you suggest, like a suppository?
Okay, so I'm not going to suggest any treatment recommendations. What I do suggest is that you continue to follow up with the specialist and try to figure out exactly what's going on. A lot of the times in the system, what happens is once they determine, okay, nothing serious is wrong, they kind of push you off. This is where you, as a consumer, have the right to go in and say, well, I want to figure this out. I need to understand what's going on, because you using hemorrhoid cream and then not having hemorrhoids, we had a caller, I remember a few weeks ago, John, that was using wart cream for what wasn't a wart.
Right.
You shouldn't be doing stuff like that. You shouldn't be self-medicating. You shouldn't try to be self-diagnosing. You should be working with professionals to get you professional advice and following the recommendation. The other dangerous thing here is when you're working with multiple people, make sure that they're all on the same page, because the worst thing you can do is have multiple practitioners that you're working with that are all on a different
Not
page about
communicating.
what's going on, and have them communicate, or you make sure that you're doing the communicating between them so that you have a consistent goal and outcome that everybody is aiming for. That would be my recommendation.
Well, here's how it is. When I went to Padeneau, he went in and he examined me. He says, Jean, I see nothing serious here. And he went right up and he really hurt me. And he says, you're on your own. Now, what you got to do is this. Try different ointments. Try different things. Just keep on trying.
Well, okay, but again, so, and I don't know who this doctor is, but, you can go get a second opinion from someone else who specializes in that. So, that doesn't mean if someone says that, that's why we have a healthcare system. If you're not certain about what someone has told you, there's tons of other professionals out there. Go back to your family doctor, continue having the conversation, get them to send you to the right people, because that's really where this needs to go. There's, again, this is very dangerous when people are trying to self-diagnose, trying to self-medicate. and I can't comment on whether the doctor really said that or didn't say that. I don't know. But, it's something that you have to continue that communication with your healthcare team.
Yeah,
for sure.
416-870-6400 star 640 on cell. You still got some time. Got some open lines here. The Dr. Payne Show. It is 12:44. Got some time to call through. Yeah, 416-870-6400 star 640 on cell would be the number. Hello, Shelley.
Hi there. How are you today?
Yeah, I'm great. We're great. How are you? What's going on?
Okay, so in September of 2014, I was in a car accident and right away noticed pain in my low back. And turns out it was herniated disc in L5S1 that was causing the problem.
Okay.
Now, I do heavy work for a living. I work in an automotive factory, so I was off work for 16 months. I went back to work, and my physiatrist gave me a no bend, no twist restriction at work.
Mm-hmm.
But since then, I've had constant pain in my low back. And over Christmas, I picked up a laundry basket, and I was out of commission, and I'm actually still feeling like the pain is worse now,
mm-hmm.
and it's different.
Right.
I've had cortisone injections. I go every time I see my family doctor, I'm complaining about the pain. And anyway, last time I saw the physiatrist, he told me it's pretty much I'm just going to have to live with it.
Okay, so what's kind of your question for me, or do you just kind of want my general opinion?
Yeah.
Yeah.
Do I just have to live with it?
Well, not necessarily. I mean, anytime something goes on for a long period of time, the question becomes: this is where again an assessment is probably a better idea, because we have to try to understand, okay, exactly what happened, the mechanism of injury, because different types of collisions can affect the body in different sorts of ways. From that point, we need to understand, okay, what did you do following the accident? What type of therapy was recommended? What types of medications were you on?
I've had a lot of ongoing physio. I've tried anti-inflammatories.
Right. So again, and so the point I'm trying to get at is when I ask someone what was the therapy, it's not enough to just say physio. I like to get a sense of exactly what the treatment plan was. So what things were done initially, what things stopped happening, what new things were introduced. Did they try to wean you off? Were you doing rehabilitation at home on your own a lot of the time? Because that's a big key in these types of injuries is proper rehabilitation. But then you said something that's very interesting. You said your doctor, your physiatrist, sent you back to work with a do not bend, do not twist policy. And then how did you hurt yourself? At home, bending to pick up a basket, right? That when they send you, and this happens a lot of the times where people take the note for work, but they don't necessarily follow it for day-to-day life, right? So if you were recommended do not bend and twist at work, well, your body doesn't know the difference between work and at home. It's a do not bend, do not twist policy all the time in order to prevent an injury in that area. So it's definitely, this is where proper education, right? And I think a lot of the times, and I'm not putting this on you, Shelley, it's on the healthcare system that we don't do enough education of our patients to differentiate these types of things, right? Because we do send people back to work and say, do not bend, do not twist. But we don't stop and think these are average people. They don't necessarily, they may not understand do not twist, do not bend.
The other 16 hours a day, right?
Exactly. And so it's so very, very important for good education to be part of something like this after accidents and chronic pain issues. So, I mean, Shelley, if you're interested, give me a call. We can set up an assessment and we can go through the whole thing with you and try to figure out if there's a way to get you better.
Okay, awesome.
Okay. Thanks,
all right,
Shelley.
thanks, Shelley. 1-855-55 Dr. Lou. We'll get John in here before the break. Good afternoon, John.
Hey, how are you guys doing?
Good, pal. What's up with you?
So my question is really about a family member, not so much about me, but basically they've got a disease and they're on pain medication. They've been on pain medication for quite a while. And I guess I'm worried a little bit because I don't know how much pain there actually is, and they're constantly on it.
Okay.
They wake up, they say they have a headache or whatever.
Do you know what the disease is, John?
I do. I don't know if I really want to.
Okay, fair enough. Yep.
Yeah. So like there's not eating well, and that I don't know if that maybe can do with the medication, or just like is there any kind of non-invasive steps to kind of get somebody to.
Sure. And so this is a big issue that we face in our society right now with the conversation of pain medications. And this past week was Bell Let's Talk Day. And one of the things that's so very important in pain management is understanding the mental health issues that arise with pain. And people don't realize this, but pretty much all chronic pain situations have a mental health component, and they're not dealt with the right way. And a lot of the times, and this may not necessarily be the case with your friend, John, sometimes it's mismanagement on the part of the system where they've been sent down the wrong path to recovery. Sometimes it's on the part of the individual that wants that crutch in their life. They want to be able to say that they have this so they don't have to do that, or they don't have to do this. And so it's really important to try to work with these people in a multifactorial way, where when you're looking at pain, you're looking at it trying to understand the physical components that contribute to it, the social components that contribute to it, the mental components that contribute to it, and even sometimes the spiritual components. And I'm not talking religion, I'm talking about the belief in something. And so working with these people in a very, very holistic manner is where we're moving towards, and it is the best thing to really get people better. They have to take responsibility. I deal with so many chronic pain patients, and I can tell you that the vast majority do not want to take true responsibility for what's going on with them. And when they don't want to do that, they never get better. The biggest thing in chronic pain is the individual needs to want to make the change. That is the very most important factor.
Right.
And if they don't come to that realization, what do you?
One of the things that I say, and I learned a long time ago, and I was told by one of my first clinicians, you can only help someone as much as they want to help themselves. And unfortunately, that's the reality. It's a sad reality. You're a good person for wanting to try to help your friend. I'm not suggesting you don't keep trying to encourage them. But again, anytime you have someone brought in by someone else almost by force, right away, I know it's destined for no failure. You can only help, and this goes for everybody, you only help someone as much as they want to help themselves. And for people out there that are listening to this, the onus is on you. If you're suffering, you have to make the changes.
416-870-6400 *640 on cell. More of your phone calls as we get close to 1 o'clock here on the Dr. Payne Show. 2-hour show next week, by the way, starting at 11 a.m. right here, Talk Radio, AM 640. 12:55. You got a couple minutes here, 416-855. You heard it here first. Well, probably not really. Susie, hello there.
Hi, how are you?
Good. What's going on with you?
I just have a simple question. For the past month, I've been suffering from severe dry eye, and I don't know if that's due to not taking enough supplements, or maybe because I have an autoimmune problem with low platelets. I'm just a little confused why that would just come up.
Sure. It could be a number of things. Do you have a history of allergies at all?
No, I didn't. Well, once they told me I did, but they told me maybe about 2-3 months that I did, but I thought, it had gone away or something. But
have you tried to take any type of allergy medication, like an over-the-counter antihistamine, anything like that?
No, I haven't.
Yeah. So sometimes it could be allergies, and allergies people often think that an allergy is kind of like you had it when you're a kid, and whatever you have when you're a kid is all you'll ever have for your whole life. That's not true. It could be something that you develop, something new in the environment that surrounds you. That could be something that's aggravating you. It could be related to the cold, right? It's obviously not been the best weather. It could be due to diet changes. Sometimes the things that you eat can affect the way your body works.
Right.
So yeah, it could be a multitude of things affecting or creating the symptom of dry eyes. Now you said something about an autoimmune disease with low platelets. You do have an autoimmune disease, or you think it could be an autoimmune disease? No,
I do have low platelets. I just went again to the doctor, and he told me that they were pretty low, and they're sending me to a specialist, a hematologist.
Yeah, and so all you know is that it's low platelets. You weren't diagnosed with anything? Yeah.
No, it's just low platelets. I don't know. It's pretty long, the terminology word. I'm not sure how you say it, but it's just low platelets in my blood, they told me.
Yeah. Okay. So anytime for sure, if you do have an autoimmune disease, autoimmune diseases do tend to affect the eyes. So it could very well be related to that. So it could be a multitude of things. I would say based on the history that you're describing to me and the fact that there's potentially something autoimmune going on, that'd be the first and foremost thing that I'd want to try to figure out and rule out. And then if it's not that, then moving to probably the other things related to either diet or environment changes that's creating an allergy or something like that. But yeah, I would definitely say continue following up with the hematologist and try to get an answer as to why whatever low platelets that you have, why that's happening and what the actual diagnosis could be. Because like I said, autoimmune diseases can affect the eyes for sure.
Oh, okay. I know because they've always told me that there's just no cure for it, and I told them, well, what can I do to to bring my blood platelets high? And they're like, oh, well, it's just something in the blood, and I'm like, okay.
Yeah. So
I've been like that for the last 5 years.
For sure. And so, if everything is, all good and you've tried all the medical treatments, this is where I think trying to use some integrative medicine approaches where maybe some acupuncture, some naturopathy, I'm not suggesting it'll cure it, but it may help it. So that may want to be a component. And again, if you're looking for those services, those are things that I offer through my clinic. So give us a call.
Appreciate it, Susie, and appreciate all of your calls. Again, a reminder, next week we're on here at 11 a.m., not 12, extra hour here at the Dr. Payne Show. In the meantime, 1-855-55-Dr. Lou. That's DRLOU, Dr. Lou, 1-855-55-Dr. Lou, info@paincarecanada.com through email. We'll see you back here next Saturday at 11 a.m. on Talk Radio, AM 640.